Okay, some postpartum complications. There are two major ones we're going to look at. Of course, you also know that patients are at risk for DVT and PE and some other things, but we're going to look at postpartum hemorrhage and postpartum infection. Postpartum hemorrhage is primarily caused by uterine acne. Remember those crisscross muscle fibers? If that muscle is relaxed, that allows for bleeding. Postpartum hemorrhage can be deadly. I've seen blood dripping off the end of the bed. It can also come from lacerations. Sometimes those lacerations can be cervical or vaginal. So if you have a trickle of blood and it doesn't seem to be from the uterus, have the provider look for cervical and vaginal lacerations. Uterine acne sometimes can be from retained placental fragments. So if you've done what you know to do and you can't keep the fundus firm, the provider may need to check for retained fragments. It's more likely to happen if the patient's had an induction, if they've had a very long labor or a very fast labor, because the muscle is tired. If the uterus was overstretched, so more than one baby, too much fluid, okay. If they've had several babies, so the more babies they've had, if there's any medication that relaxes the uterus, like MAG, okay, and if the bladder is distended. Large bleeding is easy to see. Okay, we're going to see the blood coming out. Make sure that you're looking under the buttocks on those drapes because it can pool underneath the hips. But also pay attention to that slow trickle that you just can't get to stop because they can lose a lot of blood that way. Management, there are meds that are usually given for prophylaxis. Most places add Pitocin to the first liter or two of IV fluid after delivery. Some places might use something different, but typically it's Pitocin. Breastfeeding or nipple stimulation also can be prophylactic. And then we have some drugs that we use if those don't work or if they hemorrhage anyway. Additional doses of Pitocin can be given. Methergin can be given. It's an ergotamine, so it increases blood pressure. So we cannot give Methergin to a patient with postpartum hemorrhage if they also have high blood pressure. Hemabate and misoprostol are both prostaglandins. They can stop bleeding pretty quickly. That cause uterine contraction. They will also cause a low-grade fever and uncontrollable diarrhea. So as soon as that patient is stable, please give them some Tylenol and some antidiarrheal. Uterine massage also helps. If it's because of clots or placental fragments, those may need to be removed and the provider may need to repair lacerations. Postpartum infection. Risk factors: longer time with their water broken, longer labor, premature rupture of membranes, multiple vaginal exams, internal monitoring. Think about the things that put you at risk for infection: C-section, obstetric trauma, or procedures like vacuum or forceps birth, and a patient who's compromised and at risk anyway. Management, we want to prevent this and we want to catch it early if it happens. So general health measures, get it reported to the provider so they can do antibiotics. In the next section, we're going to talk about the transition from newborn or from fetus to newborn. We only have 2 sections left.